Good morning, everyone, and a very, very warm welcome. Can I start with a big round of applause for all of you, please? You know, when we were thinking about the theme, we were thinking about access, affordability, quality, and somewhere when Dr. Mahajan, Dr. Puri, Dr. Lal, and I kind of started thinking, what is it that's changed for India in the last 25 years? And I'll give you some statistics before I tell you what's changed. And I'll probably ask you some questions as well, so that the engagement meter is slightly high. Do you know what percentage of beds today are actually developed in this country by the private health sector? Take a guess. 80 is private? Okay, it's a number. What percentage of beds in this country are in the private sector? Sorry? 2/3. We have folks from EY. 60%, okay. What percentage of healthcare delivered in this country is in the private sector? 70%. You know, look back 2-3 decades, and you'll remember that there were a few cities we could get to for private healthcare or for healthcare at all. I've known this domain a bit closely because between the age of 14 to 24, I lived in a hospital. And I could tell you if it is quaternary care, looking at transplants in this country, you would actually go to a metro city. Affordability will be a significant challenge. And you would actually wait in queues till cows come home. Till the legends who are seated here. Dr. Pratap Reddy, thank you so much for being here. I went to Chennai, I met him to invite for this conference, and I can't tell you how beautiful that conversation was. Not only did I learn about what he's done over the last 40 years for health systems in India, but I also learned the why part of it. And then there's a book called Love and Profit, very much like what the industry is going through currently. And the book says data is not fact, fact is not information, information is not knowledge, and knowledge is not wisdom. In that 1.5 hour, I realized that what we need for the next 25 years is going to be pure play wisdom and nothing else. The theme for today is about celebrating the people who made this happen. When I came back from Indonesia, one thing I realized that India is blessed. India is blessed with 1.4 million doctors. India is blessed with 300,000 odd hospitals today. India is blessed with the fact that access is no longer a challenge as it used to be 30 years back. And a lot has been developed, delivered by the torchbearers and legends of today. Thank you so much for being here. Over the next 2 days, it's learning from what you've done. It's an understanding of how we can take this forward, take this mantle forward for taking India to a different level of healthcare delivery over the next 25 years. To all of you, thank you for being here. Have an enjoyable 2 years, and thank you once again.